Today I am going to discuss about inflammation, which is a novel target in cardiovascular disorders. Before I start my discussion today, I would like to discuss about a clinical case that I had come across. This was a 19-year-old boy when I was practicing in actually Jalandhar, Punjab. He had no risk factor, traditional risk factors, had some chest pain in the evening and went to a local doctor. Pain was so severe that they even took the ECG, and ECG was reportedly said to be normal. He was sent home back with antacids, and the next day he came to us with a frank myocardial infarction. A 19-year-old boy, no traditional risk factors, no diabetes, no hypertension, no smoking, no history of drug addiction, and had a massive anterior myocardial infarction, presented to us with cardiogenic shock, low BP. We did immediately angioplasty, we saved the life, but the patient had severe LV dysfunction. Heart is very poorly pumping, and he will have to live with it for his lifelong. So what went wrong and where? The patient's ECG actually showed mild STT changes, and if it was somebody who would have suspected a cardiac disease, they could have actually started the treatment. But nobody suspected a cardiac disease because a young male, no risk factors, why would somebody think of a myocardial infarction? So there is something grossly wrong in our understanding that only some traditional risk factors are involved in the causation of the heart disease. So the most important thing is our understanding about heart disease is not totally complete. It is still limited. So we need to understand more and more about the heart disease. So we are going to talk about that. So we all know that the leading cause of death both globally and in India is cardiovascular diseases. So what causes this cardiovascular disease? It is the atherosclerosis. 12 to 16% of coronary artery disease patients in India are young people. So what causes the atherosclerotic cardiovascular disease? There are several risk factors. It could be diabetes, it could be increased cholesterol levels, it could be hypertension, it could be hemostatic or thrombotic tendencies, the behavioral abnormalities like sedentary lifestyle, psychosocial stress, it could be demography or genetic factors. But that is not just all. What is important is when a person has got one or more of these risk factors, we say that this person has got an increased risk of developing heart disease. But as we see, if we take all the patients who are having cardiovascular disease, only 38% of the patients have got two or more risk factors. And more than 60% of patients have got either no risk factors or only one risk factor. And more than 50% of our patients have got normal cholesterol levels. So cholesterol is not the only factor that causes atherosclerotic cardiovascular disease. Then what it is? Now what I have analyzed is there is a very significant part of inflammation. It is the atherosclerotic cardiovascular disease, not just a pool of lipids in the arteries. It is active inflammation from the body, the innate and adaptive immune responses that causes cardiovascular disease. So then how can we say that actually inflammation is one of the important aspects? Inflammation has got some circulating markers, and one of the important markers is C-reactive protein. We all know that. All patients who are having inflammation, the C-reactive protein is elevated. But in chronic inflammation, low-grade levels of inflammation, the C-reactive protein may be undetectable by the routine methods. So what we use is high sensitivity assays. So what we call it is high sensitivity C-reactive protein. And it is a major breakthrough. Other than your cholesterol levels that everybody talks about, some studies showed that high sensitivity C-reactive protein, if it is elevated, more than 3 milligram per liter is called as high risk. If it is elevated, even if the patient is having everything normal, if C-reactive protein levels are high, they are at high risk of developing cardiovascular disease. This can be very well seen in these two graphs. The last column is high C-reactive protein. So whether it is all levels of Framingham risk score or all levels of LDL cholesterol, if the C-reactive protein is elevated, the patient is at high risk of developing cardiovascular disease. So definitely inflammation is a very important aspect of developing cardiovascular disease risk factors. That's why recent guidelines have given more importance to assessment of high sensitivity C-reactive protein in assessing inflammatory status and the level of risk for developing cardiovascular disease. Let us try to understand what actually happens in the atherosclerosis, how it develops, how atherosclerosis happens in the body. The first thing is the cholesterol, the bad cholesterol, what we all call, the low density lipoprotein cholesterol, gets into the arterial intima. Once it gets into the arterial intima, it gets oxidized. The LDL becomes oxidized, what we call as oxidized low density lipoprotein. It is a very important trigger for inflammation. This leads to conversion of monocytes into macrophages. These macrophages engulf the oxidized lipoprotein and they form what is called as foam cells, and this is the initiation of atherosclerosis. This is what is the initial step called as fat streak formation, and this leads to further accumulation of smooth muscle cells and the atheroma builds and ultimately leads to coronary artery disease, what we call as angina pectoris or unstable angina or heart attack, whatever you call. Ultimately everything starts from this particular level. So at one particular level, the oxidized LDL leads to conversion of monocytes into macrophages, which initiate the whole inflammatory cascade. But simultaneously, they also initiate a protective mechanism. This is what is there in the body. As long as there is a bad thing happening, there is always a good thing also happening. And that good thing is through the dendritic cells, that is called as kynurenine pathway. So the inflammation occurs through the macrophages through NF-kappa B pathway, and a good thing, that is anti-inflammatory mechanism, occurs through the kynurenine pathway. These inflammatory markers are released from the macrophages and they lead to increased activation of monocytes coming into the atheroma, and that leads to a vicious cycle. So more monocytes come inside, they release more cytokines, again more monocytes come inside. So once it is initiated, it becomes a vicious cycle, and that is why inflammation plays a very, very important role. The understanding of atherosclerosis has changed drastically after our understanding of inflammation, because initially we all thought that it is just cholesterol. If we decrease the cholesterol levels or if we take statins, it will all come down. No, it is not just statins or cholesterol, it is also inflammation. We have to target this. So how do we do it now? Normally what we have is, one is the availability of statins. They decrease the level of cholesterol, so your disease comes down. This is a pointer, Tapan. Can I use? Okay, what we are actually talking is statins, which are protective by decreasing the levels of LDL cholesterol. The next thing is, we also have got antiplatelets which act on platelets to prevent the occurrence of further inflammation by releasing mediators. We also have got PPR gamma inhibitors like thiazolidinones, which also inhibit inflammation. But what are the novel targets? We are talking about innovation today. So what are the new things that can be done? The new things are targeting this pro-inflammatory pathway, that is nuclear factor kappa B pathway, and anti-inflammatory pathway, that is kynurenine pathway. There is a very important metabolite called as 3-HAA, hydroxyanthanilic acid, which is an anti-inflammatory metabolite, and this has shown tremendous scope in preventing inflammation in atherosclerosis. We also have got some inhibitors of this inflammatory pathway, and one of important them is curcumin. I will discuss about them in detail now. So trying to understand how this nuclear factor kappa B causes initiation of inflammation. This is the main inflammatory mediator. So this is actually kept inactive by inhibitor of kappa B, and whenever there is a initiation of inflammatory stimuli, that dissociates the inhibitor, and now the NF-kappa B becomes active. This active NF-kappa B now translocates into the cell's nucleus, and it activates the transcription of the inflammatory mediator mRNAs, and that leads to release of pro-inflammatory cytokines. All of these we know already. Tumor necrosis factors, IL-6, IL-1 beta, all of them get released. Not only that, they also express adhesion molecules, and all of them lead to further progression of inflammation. So how can we prevent this NF-kappa B? This can be inhibited at multiple levels by one compound called as curcumin. So it prevents the activation, it prevents the translocation into nucleus, and it prevents the release of the inflammatory mediators. And can anybody guess what is this curcumin? Curcumin is a component of our indigenous medicine of India, that is haldi ka powder. Many of the Ayurvedic medicines and Chinese herbs use haldi powder for treatment, and this is an important component of that. So curcumin by multiple methods decreases the inflammation, and it has been proven in one study which has been done in Thailand. It shows that if you give curcumin, that is the haldi ka powder ingredient, the heart attacks related to bypass surgery, after bypass surgery, they are decreased. They also significantly reduce the serum cholesterol levels. So it's actually from kitchen into medicine. What we daily use, the haldi powder, that can actually become a part of our medicine. So it is one very important aspect. The second protective pathway that we are talking about is kynurenine pathway. So tryptophan is amino acid. By one method, it gets converted into 3-hydroxyanthanilic acid, that is 3-HAA. It has been shown to have anti-inflammatory properties. They did a very interesting study in mice, where they injected this 3-anthanilic acid, and they actually were able to show that it regresses the atherosclerosis. The mice which have developed atherosclerotic plaques, 80% of the burden of atherosclerosis came down. And not only that, during that experiment, they also noted that it decreases the level of cholesterol also. So it has got two effects. One is reduces the inflammation, second is reduces the level of cholesterol also. So that is a fantastic thing, that what statins do. Statins are a breakthrough in the innovation of cardiovascular medicine. What statins do, the same thing even 3-HA is also doing. It decreases the level of cholesterol levels, increases the level of HDL cholesterol, that is a good cholesterol, and it decreases the amount of atherosclerosis which has already happened. It is still in the experimental stage, but it gives a lot of promise. Why we are stressing so much importance is, we all have been using statins like water. Whenever a patient is having risk factor, heart disease, cerebrovascular disease, stroke, whatever, we give the patient statins. But does it prevent all the events? No. We are giving to so many patients, but still so many patients develop cardiovascular disease. So we have to find out new methods to inhibit this inflammation part of the atherosclerosis, so that more and more patients get protected. So in summary, what I am going to tell is, 3-hydroxyanthanilic acid is an intermediate metabolite of kynurenine pathway, and it is an important factor in reducing the lipids as well as reducing the inflammation. Not only these two, there are so many things in pipeline, but still undergoing a lot of clinical trials, like phase 2 and phase 3 clinical trials. So to conclude, what I want to take home message is, despite we know that there are so many traditional risk factors, but still our understanding is poor, because there are so many patients not having any risk factors still develop heart attack, still develop stroke, and one of the important mechanism is inflammation. So by reducing the level of inflammation in the body, maybe we may be able to save more and more patients. Thank you so much for the patient listening.